We've been talking about the top 5 concerns family caregivers need to know about if they are caring for a loved one who is immobile or has the inability to move themselves or reposition themselves in bed or in a wheelchair. And we are on number 4, Sen, already. So number 4 is contractures. This is an interesting one.
Yeah.
I mean, that's like a whole
thing.
It is. It's like a whole. I mean, like as far as therapy is concerned,
right?
You know, physical therapy, occupational therapy. You guys address contractures as a part, almost like a sub-specialty within your practices. Yeah.
So a contracture is basically when a muscle shortens up.
Okay.
And the word I use the word kind of sets up because sometimes it feels that way.
Yeah.
But the muscle basically shortens, and then you lose some range of motion in that joint. So, for example, usually when we lay in bed on our backs, our feet tend to kind of flop down.
Yeah.
Okay?
Yeah.
If someone is not able to move and reposition, you think about the heaviness of the covers, and that adds to that weight. If you stay in that position for a long period of time and you're not an active individual, you can't actively move out of that position, then the calf muscle, in that instance, starts to shorten. Oh. So then you lose that upward motion of the foot.
Yeah.
And that's sometimes called a plantar flexion contracture. So because your calf basically shortens up and you lose that range.
Yeah.
That can happen across the back of the knees is very common. Yeah. So the knees can, if you are bent in a position, a lot of times if people spend the majority of their time in a wheelchair and don't have active movement and can't stretch those hamstrings out in the back of their legs, or if they're in bed and they tend to kind of curl up a little bit, that can happen across the back of the knees, and then you cannot get the knees straight or the legs straight.
So like they're constantly in a 90-degree angle, like they're sitting in a chair.
Yes. Okay. Sometimes depending on the diagnosis, if you have a little bit of increased tone in your muscles, so they kind of stay more active, you can get that in your arm, across the elbow, you can get it across the wrist and the fingers and the hands. It just kind of depends on the diagnosis. So, that's especially when you have an individual that is dependent with care, passive range of motion. You actually assisting in motioning those joints through their full range to try to stretch and prevent those contractions.
So passive range of motion. We call proms.
Yes.
Proms, like you're going to the prom, but it stands for passive range of motion. So if you're wanting to know more about how to provide your loved one with passive range of motion exercises, you can look that up online. I'm sure there are lots of videos that address.
Yeah, and we have those videos in our caregiver
resource library.